Welcome to the International Public Safety Data Institute May webinar. I'm Dr. Lori Moore-Merrill, and I'm the President and CEO of the IPSDI, and we're excited to have you with us today. I will give you a little bit of logistics as we go through the presentation today. We do have opportunity for you to use the chat function for any questions you may have. We will read those out live, as many as we have time for during the webinar, and have our panelists answer those questions today. For those of you who may not be familiar with the IPSDI, we are a collaboration of fire service organizations built from partners that we have had for many, many years. The IPSDI is in fact a nonprofit research and data science organization, but built by a collaboration of these organizations. We have actually been together as a team for nearly 18 years. So these research groups are the same that did the NIST studies, for example, that you may know, the high-rise and residential fire ground reports. So our research council remains intact. And as I said, many of them for nearly 18 years. Two of our panelists today are wonderful members of that research council and have been with us going on almost a decade, as they have contributed to both the Enforce project and more substantially to the Fire Cares project, which we will mention again at the end of this session. So today, I do want to introduce you to two of members of our research council, Dr. Dave Butry and Stanley Gilbert. And so tell you a little bit about each of them before we turn the session over to them. So Dr. Dave Butry is the Chief Applied Science of Economics Office at NIST, and he researches within that arena. And some of the more related research that you will identify with is that he does lead research focused on measuring benefits and cost performance of life safety technologies, certainly relevant to this group. Building codes, looking at standards, estimating the economic impact of firefighter injuries, for example, and developing fire risk models. Dave will also mention more of the work that they are doing during part of his presentation. Dr. Stanley Gilbert is also an economist with NIST, and he joined NIST back in 2010 and has been part of our team essentially for that same period of time. His work is primarily on disaster resilience and wildland residential fire. Stanley will be doing a good part of the presentation today, and he has done work also in estimating how much people are willing to spend, for example, to pay to avoid fire risk. So these are all interesting questions as we deal with community risk reduction, as we deal with operational deployment and risk in the communities. So without further ado, let me introduce you now and have them take over the presentation. Dr. Dave Butry and Dr. Stanley Gilbert. Dave?
Great, thanks, Lori. Again, I want to say thank you for inviting us and allow us to present today. It's a great group. Your team did a fantastic job getting the word out, and we're really excited to share a little bit of what we've been working on over the past few years. Before I turn things over to Stanley, I'm going to give just a few brief remarks about some of the concepts or motivations to this idea of the economics of fire protection, or fire economics, as I like to call it. You might wonder what a couple of economists are doing studying the fire problem. And largely, it comes from this idea of studying trade-offs. That's kind of fundamental to economics, is understanding scarce resources, allocations of scarce resources, and understanding trade-offs. And why that matters is because ultimately it's about informing the decision-making process. So, things like benefit cost analysis, which you might be familiar with, that doesn't ultimately lead to a decision. There could be other things besides just financial considerations, but it's part of the decision-making process. And that's what the economic component is oftentimes evaluating the benefits and costs. Of course, there's limitations to this type of analysis. It really requires you to be able to kind of monetize or to put values on things that you're considering. And so this often requires you to be able to measure what you're studying, the impact, for instance. So if you're thinking about life safety technologies, it's a function of understanding its cost, but also understanding its benefits. Sometimes its benefits may be just the impact that it achieves, whether it's through life safety or other cost reductions. So the trade-off analysis is usually we're doing it between doing something, the cost of doing something, and then the value or maybe the savings from doing nothing or something else. I'll talk about costs. I think of these mainly as expenditures on categories, things like prevention, mitigation, suppression, and losses include monetary value of damages. So you think of the physical damage, if you monetize that to economic terms, and there's both direct losses, structure loss, for instance, and indirect losses. For instance, if a warehouse fire might result in disruption to supply chains, so that can have larger economic impacts. Stanley, could you go to the next slide, please? Again, at the kind of fundamentally, economists, when we're thinking about some of these ideas, we're thinking about optimality and kind of from a role of society of, how much is the right size? How do we right size things? And oftentimes it's comparing the benefits and costs of different interventions and realizing that there may be a kind of a sweet spot where the amount of spent on intervention is achieving a large amount of benefits in terms of prevention of fatalities and injuries. So it's this calculus of looking at kind of costs and losses together. Stanley, the next slide, please. So this is a quote I really like, being from NIST. Obviously measurement science is a big part of what we do, but if you cannot measure it, you cannot improve upon it. Or if you can't measure it, how can you manage it? And so this is kind of a call to data, that we need data to be able to track and understand interventions and success, but it requires data to do this. So that's a large part of what we do. In our work in the Applied Economics Office is trying to use data to better understand trade-offs for decision making. Stanley, if you can go to the next slide. Of course, there's consequences for not having good data. There's measurement challenges. It can result in problems with accuracy, underreporting, errors in reporting. You might not be accurately measuring the benefits and costs. It might lead to an uneconomic decision. And there's lots of uncertainties, and it's a changing world. There's lots of different phenomena that are going on. Lots of changes in the world of fire. We think about wildland urban interface fires. Really, we've seen a growth in that area over the last couple of decades. Also, are lacking our models linking interventions, so things that we're doing to try to improve the fire problem with fire outcomes. So changes in maybe numbers of fires or fatalities and injuries. And Stanley, if you go to the next slide, please. And finally, I'll leave you with this before I turn things over to Stanley. The Applied Economics Office at NIST, we've been working in the area of fire for a number of years. I've kind of grouped some of these topic areas that we've worked in. Stanley's work currently has been mainly looking at issues related to fire. A report recently out looking at mattress flammability standard, the U.S. mattress flammability standard, with respect to flaming ignitions, looking at the impact of that standard. He's done work measuring the impact of population vulnerability or frailty and the role that it plays on fire-related deaths and injuries. He's also been extending that work to look at the role of vulnerability or frailty in a population and how that plays in terms of deaths from other natural hazards. So with that, I'll turn things over to Stanley to talk more about using census data to better understand the occurrence or prevalence of smoke alarms in the United States. Stanley?
Thank you. And again, I want to thank you for offering me the opportunity. What we were interested in doing with this is answering two questions. We were wanting to determine the effectiveness of smoke alarms in homes and wanting to determine the geographic distribution of smoke alarms in homes. In other words, the first question we were asking was, if you put a smoke alarm in your home, how big of an effect is that going to have on your fire risk? And from the perspective of a local fire department, for example, where do I go to find the homes that don't have smoke alarms? And the question is why? Why would we be interested in this? Well, first of all, if you look at the data that we have, the information we have on fires, if you go through and read the NFPA reports, for example, one of the things that they will say is that 35% of your reported fires are in homes without smoke alarms, but only about 5% of homes lack them. What that means is your homes without smoke alarms are a big source of the fire problem in your community. So one of the questions that we had that I was trying to answer was, okay, just how big a difference does that make? There's lots of previous research that suggests pretty strongly that smoke alarms have a big effect. Although I will add that we know for a variety of reasons that those numbers are biased a little bit. We know that there are no, we're pretty confident there aren't as many smoke alarms out there as all the surveys say. So again, we were trying to quantify that a little bit, but we probably won't get into that much. So the questions that we're asking is, how big is the effect? If I go out and I put a smoke alarm in somebody's house, how big of an impact is that going to have on their fire risk? How many smoke alarms are actually out there? And in spite of what it says, the question is, where are they? We also have evidence to suggest that smoke alarm giveaway programs reduce fire injuries pretty significantly, and reported fires as well. I mean, this is not a shock. Most fire departments have a pretty good sense of this as well, but there's been a number of studies that have actually given some really good solid support to this. Again, this gets down, again, when you're thinking about fire prevention efforts, this gets you back to the question of, okay, if smoke alarm giveaway programs are this effective, where do I go to find the homes that don't have them? And so that's one of the questions that we're trying to answer with this. Factors to account for. The data source for our fires is going to be the National Fire Information, the NFIRS, and most of you, the fire departments here, have dealt with that. One of the factors that we have to take into account is that most fires are actually not even reported to the fire department. This is true in the US, where the old study by the CPSC in about 15 years ago said that something like 95% of fires are never reported to the fire department. There's data from the UK that says the same thing, data from New Zealand that says the same thing, data from Australia that says the same thing. I don't know of any data from Canada that says the same thing, but I'd be shocked if it weren't true there as well. The vast majority of fires that occur in people's homes are never reported to the fire department. One of the things in analyzing the data, when you're analyzing the data, you have to account for that, or you're going to come up with wrong answers. So one of the pieces of this is trying to understand how is taking that into account and trying to determine what the effect of putting smoke alarms is. Some fires have casualties. Why does that matter? Well, you expect a lot of things to change once casualties show up. For example, we're relying on fire department reports to determine whether or not there's a smoke alarm in a home with a fire. We would be unsurprised if the fire department was not more diligent about determining that if there was a casualty in a fire than if there wasn't. So again, a factor that needs to be taken into account. Reporting on smoke alarm presence differs from department to department. It differs depending on casualties. Our results confirm both of those information. And again, that's factors that we need to take into account. How do we do it? Our basic data, again, is NFIRS. What we're going to do is we're going to estimate, based on the CPSC report, we're going to use an assumption of how many, on average, how many fires occur in homes. We're going to go through and we're going to estimate what percentage of those fires are reported to the fire department, depending on whether or not you have a smoke alarm in the home or not. Given that you have a fire and it's reported to the department, what percentage of those have casualties? Again, based taking into account whether or not there are smoke alarms in the home. We're going to account for the population. We're going to account for overall smoke alarm utilization. And again, we're going to take and use the ignition rates that were estimated by the CPSC. And these are our results. CPSC estimated that on average, there were about six fires per 100 households, give or take a bit, per year. What we went through is broke that out between smoke alarms and no smoke alarms. And if your house has a smoke alarm, we estimate that about 6.5 fires occur per 100 households per year. If there are no smoke alarms in the house, we estimate there are about 15 fires per 100 households per year. And what that suggests is that putting in a smoke alarm reduces the number of fires in your house, regardless of whether they are reported to the fire department or not, by 57%. I'm going to come back and talk about that in just a second. Of those fires that are reported to the fire, of those fires that occur, if you have a smoke alarm, about 1% of them get reported to the fire department. So 99% of the fires, if you have a smoke alarm, 99% of the fires in your house are put out or go out on their own, and the fire department never sees or hears about them. If there are smoke alarms in the house, that goes up to about 4%. And again, what you're looking at is by putting in a smoke alarm, the number of times the fire that I have gets reported to the fire department is reduced by 72%. Casualties per 1,000 fires. Casualties are a rare event, by the way. This is overall. This is total number of casualties for total number of fires. Again, putting in a smoke alarm reduces that by 60%. The majority of that is because the severity of the fires goes down. The majority of that is because the severity of the fires goes down. You get rid of most of you tend to get rid of most of the fires before they actually get to the point of causing injury. Now, I wanted to talk about the ignitions per 100 households. It is counterintuitive that putting in a smoke alarm, which has no fire suppression capabilities at all, would reduce the number of fires per house. What you would expect is we go out, a fire happens, it tells us that there's a fire, and we detect it early and get it out before a problem occurs. There's some speculation that what happens with putting in a smoke alarm is you catch what NFPA has called almost fires. So you get lots and lots of smoke production without quite getting a fire that triggers the alarm, and you solve the problem before it quite turns into a fire. So that's a guess as to what's going on with stopping the number of fires by putting in a smoke alarm. You may also be looking at the effect of just different people. So the people who put in smoke alarms may be less fire prone in the first place. But there are two factors as to why we seem to be reducing the number of ignitions by the mere existence of a smoke alarm. Geographic distribution. Here's the question that we're asking. For every census tract in the US, and by that I mean the 50 states plus DC, we want to determine what percentage of households in that census tract have smoke alarms. Our basic source of information for this is Census. We start with the American Housing Survey, and we're going to also use the American Community Survey and Public Use Microdata Sample. I'll give you a very, very brief introduction to each of them. The American Housing Survey is a survey where they go through and they talk to a bunch of different people in the US and ask them about information about their home. So they'll ask things about how many people live in the home, what's the value of the home, how many bedrooms, how many bathrooms, is it owner occupied or renter occupied or vacant, and a lot of other information. In particular, in 2007, 9, and 11, they asked about whether or not there were smoke alarms in the house. The problem that we have with the American Housing Survey is there's not enough data to estimate it at the census tract level. I mean, there are 70,000 census tracts in the US. There are something like 200,000 people interviewed as part of the American Housing Survey. They tend to be concentrated in urban areas. There's just not enough data to give you reliable estimates. And at the census tract level, and a lot of the census tracts, there were nobody who was interviewed about their home. The American Community Survey is an annual survey. It's the equivalent of what used to be considered the long form census. So it used to be that when the census came around every 10 years, most people would fill out a simple basic questionnaire that said how many people live in the house and some real basic information, and that was it. But a number of people went through and asked a lot more information. The American Community Survey replaced that and occurs annually. The American Community Survey can be estimated, and in fact is estimated, down to the census tract level. The problem that we have with it is that there's no information in it about smoke alarms. The second problem is you don't actually get individual level data. You get individual level data for the American Housing Survey. You do not get individual level data for the American Community Survey. All you get are averages. So for any particular census tract, I can tell you how many people, average income, average percentage of homes that are owner occupied, and so forth, but I don't get individual level data. The public use microdata sample is the American Community Survey, but it's individual level data. But it's a subsample of that. It does, again, we don't have information about smoke alarms. There's not enough data to estimate at the census tract level because they subset it. That's not everybody, it's just some of them, and there's just not enough there. Plus they aggregate it to a much larger area. And the reason for that, for all of this, is because they're wanting to protect individuals' privacy. So here's how we handle this. First, using the American Housing Survey and information in the American Housing Survey that it overlaps with the American Community Survey, we estimated a model of smoke alarm usage. So we said, okay, given the data that we have, can we predict which of these, let's develop a model that allows us to predict which of these people have smoke alarms. We then apply that to the American Community Survey, for which we do have census tract level data. And we use the public use microdata sample to perform some corrections because for technical reasons, working with averages biases the results when you're estimating your model using individuals. So we correct the bias using the public use microdata sample. And here's what it looks like. This is at the county level. And if you'll take a look, you'll see which counties have relatively high smoke alarm usage and which counties have relatively low smoke alarm usage. For example, if you look down on the tip of Florida, Miami has one of the lowest smoke alarm usages in the low 80s. You look at the Northeast and they tend to be in the 90s. You look up along the areas along the Great Lakes, they tend to be in the 90s. Most of the country in the middle tends to be in the high 80s to low 90s, and it varies by county. Nationwide, if you look at the counties, the vast majority of results are in the 90 to 95% range in terms of their smoke alarm usage. You'll have a significant number of counties that are below 90% and a few that are also above 95. Census tract on the right-hand side looks similar, it's just more spread out. And the reason for that is the counties are the average of the tracts, and when you do averages, things tend to shrink. But this is just the same thing, more spread out. Again, most of the results are in the low 90s. You have a longer tail with some census tracts even below 70% usage. A few census tracts above 95. So that's basically what the data looks like. Here's what, for the next 4 slides, I'm going to show you what a select group of specific cities look like. This is Kansas City. All the blue gray purple stuff around the outside tend to be in the 90 range or above. This stuff, the Kansas City on the left-hand side, Kansas City, Kansas, tends to be a little bit lower, tends to be around 80. That central area around central Kansas City tends to be around 80 or below. And you can see where which census tracts in this area have approximately what percentage of smoke alarms. Here's Houston. I lived in Houston, which at one time, which is why I included it. West Houston tends to have relatively high smoke alarm usage. East Houston tends to have relatively low. Portland, Oregon. Again, the same basic idea. The central yellow areas tend to be somewhat lower. The outer fringes tend to be somewhat higher. Montgomery County, which is where we are. Again, we're looking at this area around this corridor from Rockville area down toward Silver Springs. Tends to have relatively low smoke alarm usage. All the newer areas around the periphery tend to have relatively high smoke alarm usage. And again, this data set is at the census tract level, so you could zoom in on it. I can't on this particular slide, but you could zoom in on it if you had the data set. All right, here are some opportunities. The first and obvious one for any department that's interested in doing a prevention program. A data set like this allows you to target the areas where the smoke alarm usage is low. One of the results is that because we're having such a big effect on reported fires, a relatively small number of fires and injuries prevented can pay back the cost of a prevention program for smoke alarm usage, because putting the smoke alarms have a fairly big effect. Now, as researchers, we have a somewhat different interest. We would be very interested in finding areas that we can survey to validate and calibrate the data. As far as calibrating, I'm reasonably confident that if it says smoke alarm usage is high, it's high. If it's smoke alarm usage is low, it's low. What I'm considerably less confident of are the specific numbers. So if it says 90%, I'm not convinced it's 90 or versus 92 versus 87. So calibrating the data would be really nice. And validating it is nice too, because then I can go and publish a nice little paper that says, hey, we validated it. Look how neat it is. Anyway, data sources. 5 data sources that I want to specifically mention, and then I'll stop and take questions. What I've just reported to you is the first paper, is the first thing on the list. It's a paper that's on, it's actually is published in Fire Technology. The link is there. You can copy it down, or we can post it in the chat if anybody wants it. The second one is actually the whole thing that's here. This is on the NIST website. It includes both the effectiveness estimate and the discussion on where the smoke alarms are. For those of you with GIS capabilities, the data set with the census tract level estimates for smoke alarms is the third item here. It's publicly available. It's going to show up on the FireCares website soon. And obviously this training is being recorded, and for those of you who want to re-review it, it's there. And at that, I'm going to stop and take questions, if there are any.
Great, thank you, Stanley, thank you. So questions, please do put them in the chat box if you have questions. A lot of you are asking about the links. We will have those posted. Also, the recording for this session will be placed on the IPSDI website under our training tab. So all of our previous webinars are there as well. And so that's your go-to place for data training and these types of workshops. So Stanley, while we wait for them to put questions in the chat box, I have a question for you. So you talked about national data sources, and we've seen some of what you have done by manipulating, obviously, the data available and layering it, mining it for information. But what could fire departments do? We know there's no national data set for smoke alarm, distribution, but how do we get there? What could fire departments do if they are keeping their own list? If they're not, we know they should be, of where they install or distribute smoke detector, smoke alarms. But what do you recommend? What can they do to help us get to a national data set?
To get to a national data set, well, first of all, you're going to end up, to get to a national data set, you're going to end up mining information like this, because you're not going to cover the entire country census tract by census tract using local fire departments. There are a couple of things that you can do. One of them is when you send out your community service people, is again, keep track of where you go, whether or not there are smoke alarms. And before long, you'll get a sense of where they are and where they aren't. And that's information that can be used to validate information and calibrate information like this and refine it. Obviously, you're going to want to focus on the areas that have where you believe that they're most in need. As a data scientist, I would like a few in other areas as well, so I can calibrate that into the distribution. But I mean, really, the big thing for developing a national data set is send people out, find out, talk to people, find out who has them and who doesn't, and write that information down in a form that's accessible and usable.
Excellent. Dave, anything you want to add to that?
No, I think Stanley covered it.
Excellent. So I would say let's, as fire departments, those of you who are on, and many of you we have known for many years, we have to get to a better national data set here. So you can see how we pull together, and basically in the area of science, you do the best you can to pull together and mine this data. But we have to work harder on a national data set for smoke detector, smoke alarm distribution knowledge. Now, many of you have those data sets, whether it's in Excel, whether you're keeping it, even as advanced as a GIS data set, right? So having that compiled for a national data set would be something that we should work on together. I know Vision 2020 is certainly interested in that. We are interested in that, and seeing the reduction that can take place in residential fire, particularly with this kind of technology distribution. So we did have some folks weighing in from Canada. Chief Lynn Garris has done a lot of work in this area as well. So Lynn, thank you for weighing in. There are some great papers on that in Canada. So we'll be sharing those links as well with you. So any other questions that we might have? I see a couple in the Q&A. So how does smoke alarm density maps correspond to fire death rates? Are you able to correlate higher smoke alarm usage to lower fire death rates? So Stanley, you want to talk about that? I know we dealt with this when we were building fire cares and dealing with fire injury and death. So how would you answer that question?
Well, we didn't have this particular data set back when we did that work with fire cares. It's something we can use to update it at some point if we want to. What I have not done yet is I haven't correlated that. That's a bit for future research. Again, I'll tell you what I do know. Anytime anybody has gone through and done smoke alarm giveaway programs and measured the results have been significant. But I have not taken this data set and compared it to death rates or injury rates or fire rates yet, so I can't give you correlations yet. That's a future research at this point.
Okay, great. That's a great question to have pop up. So here's another question to the question of what areas lack smoke alarms. For example, attics. Has or is NIST looking into testing smoke alarms that can be built to withstand large variation in temperature in an attic, for example, and still work effectively?
I'll pass that off to Dave.
Yeah, I'm not aware of what science that they're doing in this area at NIST in terms of the technology standpoint. So if they are, I'm just not familiar. But I will say, just going back to the last question, if I might, just there has been some studies out there in the past. I don't think they were looking necessarily nationwide, but it might have been in a few communities. And I know in some early work that I've done in looking at fatality rates as they vary over homes that are sprinkler versus unsprinklered, that smoke alarms do have have been shown to have a positive effect in terms of reducing fatalities in homes. So there has been some work out there in the past, but looking at it to the nationwide level, like Stanley, suggesting with this new data set, where with more precise estimates might have a little bit more precise estimates of the outcomes, that hasn't quite been done at this point.
Okay, great. So there's a follow-on question in this. I'm just wondering about the survey data. I'm guessing that the survey only asked if the homes had the detectors or alarms. Did the survey verify that the alarms were in fact working or that they were actually there?
It specifically asked whether or not they were working. So when you're talking about the American Housing Survey data, it specifically asked whether or not the smoke alarms were working. One of the things that I'm confident of is that the numbers were for smoke alarms were too high. Take that for what you want. We did not get a distinction between are they there and are they working. We just got a single question.
Okay.
So the idea of what percentage of smoke alarms out there are not functioning, that's a question that I've been interested in and would like to get an answer to, but it's going to be a very, very, very difficult question to answer.
All right. So Stanley, in that regard, then we've got another question about the census data being every 10 years. How long is census data considered valid representation of community demographics? You want to talk about the census data and then that American Community Survey and the difference in when those surveys are deployed?
Well, the answer to the question of how long census data is valid for is going to depend on where you're at. There are plenty of areas where population is relatively stable over long periods of time. There, your census data is probably pretty good for a long time. There are areas that are rapidly growing, and there it's not going to be valid for very long at all. And areas where it's shrinking relatively rapidly too. If you really want up-to-date current information on population distribution, the source really these days is the American Community Survey, and it's annual. If you want it down to the census tract level, you're actually looking, they actually aggregate it over a 5-year period. So really you're looking at a lag of 2 or 3 years in terms of how current it is. But if you're really concerned about things that are changing over time, the go-to source is the American Community Survey because it's done much more frequently than the decennial census.
Excellent. So another question, locally, we've discovered that the American Red Cross has a large data set based on their home fire safety programs. Have you found that? Have you looked at that or found that to be useful?
I haven't even seen it, so I have no idea.
I know that we reached out, Stanley, sorry to interrupt you, but we did reach out when we're building fire cares and have been working with the Red Cross. They are the closest to getting a national data set in this regard. And than anyone, but they still don't have a lot of what fire departments do in their data set. So they're close, but as far as an aggregate data set, that would certainly be helpful. It's got some insights and we'd love to get our hands on that from a national level for the Fire Cares project for sure. But I'll say that about American Red Cross. Okay.
I'll add one other thing. I know when I was starting to do this work, I started to look and see if anybody had done anything like it before. There was a group that were loosely associated with the American Red Cross that 6 or 8 years ago had made a start on doing some kind of a national data set like this, and it was abandoned. So again, I don't know. I haven't seen what the American Red Cross has. I'm confident they have nothing like this.
All right, good. So does the data show a difference in impact on smoke alarm giveaways opposed to free smoke alarms directly installed in residents? Now that's an interesting question.
The answer is yes. Directly installed is more effective. I don't remember what the study was. There was a study that went through and compared the two. It was not mine. It's not the study I've done. It was one that was done probably out of the Injury Prevention Institute in Dallas. They've done a lot of good work on this. But the answer to the question of which is better, is there a difference? The answer to is there a difference is absolutely yes. And direct install is far more effective, both in terms of whether or not it actually gets installed and in terms of the impact on fire reports and life safety. Both of those, it's real, it's measurable. Direct install is better.
Excellent. All right, has there been any research into what type of program works better? Sorry, I'm reading I think that's going to be the same question. Smoke alarm installation. So really, you guys are thinking a lot alike. So two people asking the same question there. Let me just see this last question. Clarify the statements spoken regarding smoke alarm giveaway programs being demonstrated to be effective, meaning free installation programs or grab and go installation. I think you sort of just addressed that. And not the giveaway handout programs to the residents. So everybody's thinking the same thing, Stanley. I think we just addressed that, the giveaways versus a direct install, and whether or not they are effective obviously has to do with whether or not a giveaway was actually ever installed. So any other thoughts on that from either of you?
The only thing I might put out there, and I'm not familiar with the studies, so Stanley, please chime in if there's more details, is that, from a cost benefit, analysis, if the direct installs are requiring more time or more expensive from that standpoint, more or less might be done because of that, and that might have some impact on the results. Certainly from a cost standpoint, it might be do fewer, but I'm less familiar with those studies.
I'll add one other thing on it. The studies that I'm trying to remember the details of. What they compared were home visits. In one case, the fire department directly installed it. In the other case, they knocked on the door and said, "Hi, how are you? Do you have a smoke alarm here? You can have one if you don't." And again, there was no question. It wasn't even a close call. Direct install was more effective.
Excellent. Thank you. Thank you. All right, last question. Do you know of any research on the effectiveness of when hardwired smoke alarms are replaced by battery only during direct installs?
No, I am not. I'm not aware of any studies or information on that at all.
Okay, excellent. Well,
it's Melissa.
Any other questions? Go ahead, Melissa.
One more question in the chat, if we could.
Oh, absolutely. Sorry. Let me just,
if you, I can read it for you if you like.
Please.
If you have a higher usage of smoke alarm, do you have data that shows of those that are older than 10 years, or that are 10 years or older, there have been issues that people have them, but they are too old or do not have working batteries?
The data that I looked at and analyzed doesn't have that kind of information. I will add one other piece of information, though, of some research that other people have done. Again, this is out of Dallas. They went through and did a giveaway program in Dallas, reported it, published the information on it. And one of their results was the smoke alarm giveaway program had a big effect, but after 5 years, the effect disappeared. So in terms of lifetime, and whether that's because by that time everybody had finally disconnected them, or their batteries had gone bad, or what exactly it is that happened, I don't know, and neither did they. But after about 5 years, the effect of the giveaway disappeared, just evaporated. So that's the one piece of information I have on timeline and duration.
Excellent. Okay, if there are any other questions, please do type them in as we do a wrap up here. Guys, thank you. This was excellent information, a good compilation of, as I said, pulling together various sources of data and mining it for the intelligence that's there, which is really our mission. So thank both of you for the presentation. For all of our participants, thank you for joining us. We do have our next scheduled webinar for June. So we'll be getting that out in social media immediately following this. So join us. That will be on the Fire Cares project. So as you just heard, both of these folks were intimately involved in helping us create the Fire Cares data set. If you're not familiar with Fire Cares, please do go have a look. Every fire department in the US has a Fire Cares page where we have assessed your parcel information, all of your built environment for low, medium, and high hazard. Stanley and Dave have been very instrumental in calculating risk, looking at your population demographics, your built environment, and other variables to be able to create algorithms to measure risk of fire in your communities, risk of fire spread, and risk of death and injury. So all of that will be seen in our June webinar. We'll also be able to show you the capabilities for running GIS from each of your stations, from running an overall GIS for your community, for your response jurisdiction, as well as looking at your effective response force capabilities within the NFPA performance objectives found in NFPA 1710, for example. So please plan ahead to join us to see the Fire Cares presentation, all of the updates that we have made in the Fire Cares system, including the addition of all of your INFERS data from 2002 through 2019. So we're excited to be able to share that with you in our June webinar. So guys, thanks again for joining us today. Thanks to our participants and our presenters. We really appreciate it. Look forward to seeing you all in June. Thanks again.